it's actually quite common for SIBO symptoms to return several months after a course of antibiotics. So even if there was initial improvement in the SIBO symptoms, taking those antibiotics, we do often see that those symptoms do return. This is because we don't really classify antibiotics as a long-term fix. They're more of a temporary solution. So when SIBO symptoms do reoccur, we call this recurrent SIBO. And it actually happens to about 45% of patients following antibiotic treatment. I'm Bex Cavanagh. I'm an accredited practicing dietitian and a gut health advocate. And with this video, I'll discuss life with SIBO after antibiotics and this recurrent SIBO. So firstly, as I mentioned, antibiotics are not really a long-term solution. They should be seen more as, a super efficient tool to temporarily relieve those frustrating SIBO symptoms. Whilst antibiotics can actually be really effective in reducing the bacterial overgrowth in the small intestine, they don't actually address the underlying cause of the SIBO in the first place, and this is what can lead to this recurrence. Also, as mentioned, it's about 45% of people that experience this recurrence, so it's not everyone, but there are a range of influencing factors that may increase the likelihood of your SIBO symptoms returning after antibiotic use. Those factors are things like age. Unfortunately, older age is more prone to recurrence, a history of appendectomy, or chronic use of protein pump inhibitors can all increase the likelihood of SIBO recurrence. So really what this knowledge is highlighting is that there's a strong need for long-term management strategies for SIBO. Unfortunately, it's not just a quick fix or as clear-cut as a course of antibiotics and you're cured. In addition to an antibiotic course, we really need to be incorporating other strategies like dietary changes, potentially probiotic use, and addressing the underlying medical condition or the underlying cause that could have led to SIBO in the first place. And all of this can help with lifelong management of SIBO and prevention of this SIBO recurrence. So if your SIBO symptoms have returned after a course of antibiotics, we're talking your symptoms like abdominal pain and bloating, constipation, diarrhea, gas, indigestion, nausea. Don't be alarmed. We do see this often. It's just super, super important to reach out to a gut health dietitian or a specialist.